just recently I was at a forum, and it was the Revere America, and that's the petition to take back the Obamacare. Okay, and the Democrats passed this, and Obama signed it into law, and now we're trying to get it back so that it doesn't go any further. So Tim Burns was there, former Governor George Pataki was there, and also a doctor was there, and his name is Dr. DeJesus, and I probably forget his name. But he spoke, and I looked at him and I'm like, from a doctor's point of view, this is what we need to hear. And he did a short but eloquent speech, and I thought everyone here would enjoy listening to him. So I'm going to introduce Dr. DeJesus.
Thank you. I'm not a politician, nor will I strive to be. But I just want to give you a little brief rundown on myself to give you some biographical information. I went to Pitt Medical School. I graduated in 1973 and have been in private practice in Greensburg, PA for approximately 31 years. And I'm still in active practice. And what I'd like to give you in 5 brief minutes is the future of healthcare in this country. On March 21st, as I stood with myself, my wife, and other demonstrators next to the Capitol building, I saw the arrogance of power when I saw Nancy Pelosi, Hoyer, and following them, Barney Frank, pass with their gavel into the Capitol building to vote for, as you well know, 3590, the health care bill. At that point in time, ladies and gentlemen, set in stone was the foundation for socialized medicine in this country. But also, more importantly, the federal government owns you right now. They will control your health care from here on in. And it doesn't matter whether you're Republican, Democrat, Independent, man, woman, child, whether you're union, non-union, federal employee, the health care system that is going to be involved is going to affect every single one of you. It will affect you, your parents, and those little kids that are running here. Now, let me give you 3 basic points of this health care bill. And make no mistake, we need health care reform because we're following the trajectory of cost that is unsustainable. But the cost of this health care bill is further unsustainable. And so the 3 things I want to leave you with is that the government take over your health care, the cost, but also the doctor shortage. And all these 3 points were not made in this fictitious debate that they had. But let me give you a point. By design, this health care bill is not for health care reform. It's for health care control. Once you have everyone under one umbrella called the single-payer system, which is what the intent is. Now, we demonize the insurance industry because, wow, my premiums are going up, I can't get this CT scan on time, my medicines are costing too much and not being covered by the insurance carrier. We're demonizing them, but in 15 years from now, you're going to be demonizing the federal government. Why? Because in order to control costs, they will ration care and deny care. Now, let me give you an example. Let's say that England has a population of 66 million. In the United States here, we have right now 309 million people. When we say denial of care because we have to contain cost, that's what I mean. For example, I am a gastroenterologist. I diagnose colon cancer. So if someone comes to me with rectal bleeding or blood in the stools, the first thing I have to do is do a colonoscopy to make sure there's no colon cancer like I found today and yesterday. After I make the diagnosis, a person is taking surgery or they have chemotherapy. We then term what we call 5-year survival. How many people are alive after 5 years after undergoing surgery and chemotherapy? In England, okay, which they tout as one of the best healthcare systems, according for men only, in the statistics of 2008, 49 men were alive at the end of 5 years. In the United States, 66 men are alive after 5 years. So that means that 17 men in England died prematurely, either because there was a delay in diagnosis or else they didn't get the chemotherapy or surgery they need. So why do you think the Prime Minister of Ottawa came down to the United States for their heart surgery? Because probably they didn't have the talent, they didn't have the facilities. So the government intent to control costs is to deny care. Make no mistake about it. It will happen here, but at a more bigger magnitude. The second thing that we have to look at is the cost. Now, of course, they said, well, we have to bring this bill under $980 billion. Why? Because we want to contain the cost. What they didn't include was a doctor fix. In other words, the money paid by Medicare to pay doctors, which amounts to about $300 billion after 10 years and all that. They didn't include that in the Congressional Budget Office. So they touted this bill as being cost effective. No further from the truth. Costs will rise dramatically, worse than they are right now. And how are we going to pay for this? Well, first of all, $500 billion will be taken out of Medicare. That means that hospitals, which require private insurance to remain solvent, realize this, ladies and gentlemen, we need Blue Cross and Highmark to remain solvent. Medicare doesn't pay the bill, neither does Medicaid. And so what will happen is, with this $500 billion cuts, you're going to see hospitals either close or have their facilities decreased. Your cardiac cath with stenting, your colonoscopies, your nurses, your doctors will be condensed. And how are you going to pay for it? Through taxation. Your taxes will go up. Not only will your taxes, your federal taxes go up, but your state taxes will go up. As we just mentioned, right now we have $1 billion deficit. In 2012, we will have a $2 billion deficit in the state. According to Governor Rendell in his budget of 2010 to 2011, in 2015, we will be in $12 to $15 billion debt. Now, part of this health care bill is that we, as a state, have to supply 10% of Medicaid expansion. That means that people without insurance, we have to pay for their insurance. So on top of that $12 billion debt that we're going to have in 2015, rise that up to 2019, because in 2019 we will be responsible for 10% of Medicaid expansion. So your state taxes are going to go up. Finally, the doctor shortage that was not addressed and all that. In 2015, according to the American Medical Colleges, okay, that's the trade organization of all the medical colleges, we'll be short of 150,000 doctors in 15 years. So by the time that young little girl is, what, 17 or so forth, there'll be 150,000, but even more. I predict there'll be more than 200,000 less doctors in this country. Why? Because who wants to go to medical school, which costs $150,000 at the end of the road? The government tells me what I have to do to take care of you, sir, and also I get paid very low wages. So we lose the best of the best. We're heading for a healthcare bubble, a rising population, an aging population, less doctors, and also deficits. We're in our trajectory for a tsunami. This bill has to be repealed. It cannot be amended. It has to be repealed. Anyone that runs for office must vow to repeal this bill, including your president, Representative Altmaier. I tell you, ladies, he must be defeated. And gentlemen, he must be defeated. Because at no time did he ever explain to himself, all his concerns were what my constituents say, I will go with my constituents, and the cost. But he failed to mention the cost of hospitals with decreased Medicare reimbursements. He failed to outline the federal mandates that we have, that you must buy insurance or else you're against the law. So I agree with you, sir. I believe he will not repeal this bill. According to the American Conservation Unit, he ranks 20% out of a potential 100 of being conservative. So I plead with you in this district, you must defeat Altmaier, because this bill has to be repealed. You cannot amend it. It's a clunker. And when you have a clunker, you get rid of it. And we start from scratch. Thank you very much.